at 6.
Naomi, thank you. While doctors and nurses are on the front line of COVID care, it takes many other health professionals to help the most seriously ill recover well. From physiotherapists to speech and language therapists, our health reporter Louise Cullen has been hearing how their involvement got one man back on his feet.
In one sense, I'm just a very lucky person.
Lucky indeed. Ronald Doherty spent almost 3 weeks on ventilation after catching Covid-19 in March.
I had lost probably more than a quarter of my body weight. I woke up, I was weak, I couldn't get out of bed. I couldn't talk. My voice was a whisper to the extent that there was a voice at all.
Respiratory physiotherapists like Jenney Finney started working with Ronald even before he woke up.
When the patient's in intensive care, they are intubated, they're ventilated and sedated to be able to manage all that. So physiotherapy then will help the patient to mimic taking deep breaths. That's a preventative strategy to help try and maintain clear airways. We will assess their movement in the bed and obviously give them some passive movements and passive stretches, those that the patient is not aware that they're performing.
Her team also put Ronald on his stomach to boost his oxygen levels.
It's not so much a danger to me. When you're COVID positive, it's a severe danger to the staff because you create all sorts of droplets apparently.
And when he woke up, the real work started with Jenney and her team.
Ronnie's first session involved 4 physiotherapists helping him to sit on the edge of the bed. So moving on from there, it was just building up the strength in his lower limbs, enabling him to be able to stand, working on his balance, his coordination, and even simple tasks like just being able to sit out in a chair for increasingly longer periods. I
can remember they were asking me, do you have stairs in the house and how many steps are there? So they took me out to the back stairs in Daisy Hill Hospital. Right, we'd see if you can make it up there. And that nearly killed me, getting up those. It was very, very hard, so it was. But I should have told them I lived in a bungalow. But if it had to be done to recover, I was going to do it.
That wasn't the only challenge.
Because the tubes were in his throat for so long, the vocal cords themselves actually became unfamiliar with how to open and close. So that then interfered with the mechanisms of the swallow.
As a speech and language therapist, Jacqueline McClelland helped Ronald learn how to eat and speak again.
When Ronnie tried to swallow, it was as if he had forgotten. And then clearly he couldn't create any voice, so he couldn't communicate with us either. Everything that came out was a whisper. So with Ronnie then we pursued a therapy plan of working on engaging those neuromuscular messages again, getting the vocal cords to close. And that was very difficult for him in those first stages. But all the while Ronnie could see that these gains were being made. Instead of being fed through a tube in his nose, then that became a very modified diet.
All his food had to be pureed.
Even after I came home here, the food was there various levels of liquidized food up to grade 7 or something like that, and I was on 2 or 3 or something, which was everything severely liquidized, and it wasn't gourmet.
One of Fiona Maloney's occupational therapy team made life at home easier for Ronald.
If someone's struggling to make a cup of tea, getting in and out of bed, on and off the chair, those are the kind of basic things that people would struggle with. Especially during COVID, you would find that they've lost a lot of their strength and their balance and their power. So we have support workers that go in and do daily practice to try and get them to regain some of that independence.
It's been a long, hard 7 months, but Ronald is just about back to par.
I would have a slight cough on occasions, but not very often. I have an element of breathlessness sometimes. Apart from that, touch wood, I am grand, thanks be to God.
Oh, and we wish Ronald all the best in his recovery. All the best in his recovery. All the best in his recovery. All the best.